put us on. Good morning, everybody, and welcome to the November 22nd BOCC meeting. Would all please rise for the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, gentlemen, the first thing we have are our minutes. Do you have any additions or corrections?
I don't have any.
Okay.
I move we approve the proceedings for the Board of County Commissioners, Montezuma County, held on Tuesday, November 15th, 2022, as presented.
Second.
Okay, it's been moved and seconded to accept the proceedings of the Board of County Commissioners, Montezuma County, November 15th, 2022. All those in favor?
Aye.
Aye.
You gonna need some help carrying that back across the road? Oh, cow.
It's a heavy one.
Yeah.
All those public hearings last week.
Yeah.
Volume 1, huh?
Thank you.
Line one. Okay. No planning today, so this is going to be quick. We'll go right straight into public comment. The Board of County Commissioners welcomes you to this meeting. Person speaking during the public comment will be limited to 3 minutes, or depending on the number of people wishing to speak, it may be reduced to allow all members of the public the opportunity to address the board. When addressing the board, please state your name and address for the record prior to providing your comments. And comments to individual supervisors or staff are not permitted, and participants may not yield their time to others. And with that, the public comment session is open. Okay, seeing none, I'm going to close the public comment session, and we're going to go right into our public service. And first off, we have our Economic Development Coordinator, Ms. Thurman.
Good morning, guys.
Good morning.
So I don't have a whole lot, won't take a lot of time. Can you hear me now?
Yeah.
All right. So the first thing I wanted to talk about is our roadmaps implementation. We decided earlier this month that we were going to pause it and do a little bit more community engagement and education around what exactly roadmaps is, and how we're going to implement it with the Montezuma Community Collaborative. So we have been working on a social media plan and engagement with Commissioner Candelaria and with Mr. Anderson as far as some messaging around the project. I also met with Mr. Ortego from Ute Mountain Ute Tribe and our state liaison to come up with a good plan to figure out a best way to reach out to some of the tribal members to incorporate them into the project as well. So I did a little bit of work with that this week. Our plan is to launch probably around February. We'd like to do some actual community roadshows and go out to some of the municipalities and meet with the community members within the different communities and do that in person, not just through social media. And then hopefully around mid-March, we'll have our action teams formed. We'll have some good community buy-in. People will know about our project, and we'll be able to take some action on some of those strategies that we've identified throughout the Roadmaps project. So it's really exciting that hopefully maybe we'll get to that action stage sooner or later and see some progress on those projects, because there's been some good stuff identified through there. The other thing that I have been working on is our brownfields work within the community. We've had some great conversations with public health, with the fire department, emergency planners, and we're really focusing on how we can best address those within the community. Last week, we met with Colorado Brownfields Partnership, and they gave us some great suggestions on ways that we can possibly partner with some of the, and we're focusing, my focus is just on the commercial properties. Definitely not worried about any of the residential properties in my lens. My focus is just those commercial properties and how we can revitalize those for economic development. So Our goal with that right now at this point is to just gather some more information. It was suggested that we reach out to Lamar and Lahana. They've done some really great work down there. So I've made contact and hopefully hear back from them soon so we can have them present to our little team that we have formed, so we can look at next steps in addressing some of those properties. And then once we get some more information with you guys, we'd like to sit down and maybe locate or talk about some of the properties so we can move forward on those.
So the prioritization of those properties, so I'm assuming that public health must have a list of those also too, commercial Brownsfield property, is that?
So it wasn't necessarily public health, but Dawn provided me a list that was, I believe, identified in I think it was 2011, I think. It was.
It's been a few years
It's
back.
been about 10 years since those properties were identified. So there has been several that have been cleaned up, which is great. But there are some that are still lingering that we could possibly look at addressing. And my big focus, our big focus, is really how we can provide some resources and not just come in with an iron fist. Maybe if we partner with these business owners or these property owners to address these properties, we might see some more success with them rather than just fining or telling them to do something. Maybe if we provide them with some support to get those things cleaned up, we'll be more successful. And that's what Colorado Brownfields Partnership is really looking at doing. They are someone that does just that. And so hopefully we can secure some funding for the property owners as well. And so it's not just hitting their pocketbooks or the county's pocketbooks.
Okay,
And that's all.
all right.
Any questions?
No,
Question?
thank you.
All right, guys,
Yeah,
thank you.
let's get that together sooner than later, and let's see some action in place. I mean, we've planned
We talked
long
about
enough,
stuff
and
for a
now-
long time, right?
Now it's time for some action. Let's get some things.
Absolutely.
moving.
Thank
All
you.
right, thank you. Public health. Ms. Locke and Ms. Schaefer.
Good morning.
Good morning.
Okay, update for our department. Staffing-wise, we hired our new office assistant, which is Cindy Becky. I think you met her last week, Jim, when you were in there. We've also we've hired a new case manager, Julianne Lloyd, over in options, so upstairs on the 3rd floor. And then we transitioned our office assistant that was at our front desk over to options for long-term care. That was Christina Rica. She's over in options now. And we're going to work with her on training her to do some case management work too, once she masters the admin assistant piece. So we are currently bringing on board Holly Hyde. She has been hired. She will start next Monday. She is taking the CNC, the Colorado National Collaborative Coordinator position that Arlena Yazzie had exited. So Holly is joining us next Monday, and we are still awaiting a final background check on our CTC coordinator. So hopefully that will happen and we can move forward next week or the week after and bring her on. So we have a lot of new hires, a lot of new faces when you come into our department, and I can totally try to bring them over, introduce them to you all as they come on board if you would like. So
I would like that, because if we're in public meetings elsewhere and somebody introduces themselves, I'm like, I didn't even know you were here. Kind of embarrassing. So, yeah, if you would, I would appreciate it.
sure, we can do
Just
that. We can do that.
Hi, here I am, now I see you, I know your face.
Yeah, and if you're anything like me, remembering names is really hard, but once I see a face, it sticks, right? So, okay, so that's kind of where we are with staffing. So it's feeling kind of good, and hopefully we can keep everybody on board.
So you'll be fully staffed in a couple weeks?
Hopefully.
Okay, we're, in the process, we're looking at the paperwork and all for what we discussed yesterday with the secure transportation, licensing, and permitting process. So we're going to dig into that a little bit more. So I don't know if you all remember, I don't remember how many years ago it was the Injury Prevention Coalition was operating. It's been a few years. Anyway, we've resurrected that. The Montezuma Injury Prevention Coalition, MIPC. We've had some really good participation in those meetings. We've had a couple of them so far in our health department and conference room. The room has been full. And so we have a lot of really good community partners that are involved in injury prevention. So we actually, the coalition is going to be in the Parade of Lights. So we're going to use our WIC van and have a police escort, and so it'll be decorated, and you will see everyone walking with the van and handing out prevention information and, of course, goodies for the children. So, so that's kind of good news, and definitely needed. It kind of gets spearheaded because of our child passenger safety seat program, and we hand out a lot of car seats and educate a lot of people on that. But as with anything, when you have a coalition, when you have other interested parties that are interested in injury prevention, there's more issues for our community than just the car seats. There's a lot of injury prevention things that we could be doing. So having partners work together, I think we can make a greater impact. So that's why we brought it back to fruition. From a communicable disease standpoint, for Montezuma County, you know, our COVID-19 cases, the rate is high. The 1 to 2 week average positivity rate is high on both the CDC site as well as CDPHE site. The county risk level is definitely high. And so I did reach out to our COVID nurse and I asked her if she had any words she would like me to share. So this is from her. And she's absolutely correct. Due to the prevalence of all the home tests that are being done, which is awesome that they're being utilized, and we still have the free ones at the health department, so please come by and get them. But due to the fact that a lot of home tests are being done, there's clearly a much greater amount of COVID in our community than actually is reported, because not everyone is reporting their home tests. They're doing it. They're hopefully staying home, but it's not necessarily reported. So those that are reported are high. So just being aware of that and making good choices for yourself is what the public needs to do. There's also, we're seeing an increase in more ER visits, more admissions. This is happening statewide. This is not just Montezuma County, it's throughout the state. And we're starting to see an increase in deaths for the first time in a few months. So. We were trending downward, but everything's going the other way at this point, which was somewhat predictable because everyone's going inside, it's winter, and we all know that we have RSV, we have flu, and we have COVID going on. So, you know, people need to make choices. If they're more comfortable and they want to wear a mask, do so. Get your booster if you need it or want it. Wash your hands, test yourself, again, reiterating the free tests at the health department. They're right at the front desk. We want people to have them. So that's about it for COVID. Any questions about that? Okay. Now, a couple other communicables. So monkeypox we do not know that if it's present in our county, we don't know about it yet, is on a definite steady decline throughout the state. As far as Ebola goes, there are several people being monitored in the state for Ebola that have traveled back from Africa, but there are no cases, and we have no one in our county that's being monitored at the moment. RSV. RSV is definitely climbing, and there has been, as of last week, this is last week's information, but 900 cases of RSV that are documented. And as far as our local numbers, we're working with the hospital to get some local numbers on RSV. There's a lot. So that is, we're working with the infectious disease folks over there to kind of get a better feel for actual numbers, but there's a significant increase. We have had one outbreak of RSV in a facility here in our county. We worked with the facility and continue to work with the facility. So
And that's mostly in the toddlers or the infants?
Both.
Both?
Yeah. Flu. Flu is on the rise. We've had A and B documented cases here in our county. We've had one hospitalized patient to date so far. And again, we're working with the hospital and the staff on flu. Animal bites. We usually see 1 to 2 animal bites every week, and we're just keeping on with that. So anyway, any questions about communicable disease?
Vaccination clinics?
Still doing them.
Okay.
We've got one going on today for COVID, and Wednesday's our regular immunization, and we blend that. We do COVID on Wednesdays as well as regular immunizations. So it's still available, and encourage people to come and get it. So, and I know for flu, at least it was really challenging to get appointments for flu. I mean, everybody's so booked out. I don't know if that's improved, at the local pharmacies and the retail, the hospital retail pharmacy. I mean, I know it was like 1 to 2 weeks, it seemed like, out. But I hope that it's starting to slow down where it's not booked out so far. We're not that far out, are we? No. So people can call us too, because we've got flu vaccine. So, any questions about the health department?
How does the San Juan Basin Health Unit, I noticed Archuleta and La Plata voted to dissolve that. Does that affect you
Correct.
guys in any way?
No,
Okay.
no.
We are totally independent from San Juan Basin Health. so
Correct.
we're gonna-
Some of our, like our regional EPR position, okay, which is, Karen was in that position, now Tim Ruiz Brown is in that position for us. He works with Lori Zazzaro, who is also his counterpart over there. I don't anticipate that will change. Maybe obviously the name of their department, I think, has to change. There's some shifting that's going to happen there. But at this point in time, we are not aware of anything changing as far as working together for regional work with that. But that's really the only one that we definitely have a solid connection with. But our funding's completely separate, though. They have their own contract with the state. We have our contract with the state. So it's not blended funds at all. So, okay. Anything else? Okay, thank you.
Thank you.
Have a happy Thanksgiving.
You too. All right. Social services.
Thank you.
Just take care of these right away.
Yeah.
All right. You look different this morning, Gina.
I hope I'm not Gina. That would be kind of scary for her.
I say you've grown. Good morning, ladies.
Good morning.
All right, we'll take care of the record of proceedings first, Joe.
Yeah,
if you have no.
I would move that we approve the minutes of the September 27th Board of Social Services meeting and record of proceedings, and also approve the financials payments for the month of October 2022 in the amount of $813,888.69. Yeah, October 25th. Okay.
Second.
So it's been moved and seconded to accept the record of proceedings for Tuesday, October 25th, 2022 for social services, and also the financials for the month in the amount of $1,813,888.69 for October of 2022. Any further discussion? All those in favor?
Aye.
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 Okay, ladies, do you have anything else for us? Nothing at all. Are you fully staffed?
We are one down at the moment.
One down?
One that left last Friday, but her position will probably be refilled soon, and then we'll have to, from within the department, and then we'll have to advertise for another one.
Okay. Gentlemen, do you have any question for these ladies?
I do not.
Okay. All right,
Thank
well,
you.
have a great Thanksgiving and enjoy your day off. Bye-bye. Okay, Veteran Services, our VSO, Sarah.
Morning.
Good morning.
We are still working off of the old reports to the state. They haven't gotten us a new one. We're supposed to be reporting more, but they still haven't gotten those yet. So we're still using the old forms. It's just appointments and telephone calls and stuff. So we served a total of 495 for the month of October. Our financial report, we had $8,198.98 out. Our activities, for comparison, October 2021 was 162. October of 2022 was 166, so that was an increase of 4 over last year. Total clients assisted, 495. New visitors is 17. When I looked back at all of the reports as we've been reporting new visitors, this is the highest number we've had since we started reporting new visitors. So this is a really good plus. October, November, and December are typically our busiest months, surprisingly, for veterans coming in. But to have that many new visitors was really awesome to see for October. So that brings us to date, 78 new visitors, 2 outreach events, and then we filed 27 claims for the month of October. The income, we had 17 decisions come in, 15 of them were favorable, 2 were unfavorable. That brought in new monthly payments of $14,012.40, and new annual on that was $168,148.80, and the retro payments on those was $57,011.99. So overall, it was a very good, very busy month for October. Suicide prevention for us, we've been working with Katie Maxwell. We've been doing this collaborative thing. We've involved the vet organizations. I also have Christy, our state BSO, giving input on that as well. We've had a couple of meetings where we're just looking at resources, what's available for prevention, and then active suicide awareness. So we're realizing where we really need to work is in the prevention aspect of it. Yes, we have a lot of people who are actively suicidal, but if we can get them help before they get to that point, the better off they are. So we're looking at different resources that help our veterans locally, you know, with mental health treatment, anything that helps their living arrangements, just their attitude and demeanor in general. their, you know, their lifestyle and stuff like that. Those are the things we're looking at right now. And hopefully incorporate more and make sure we're reaching out to the veterans and letting them know that these resources are there. So that's a really big thing that we're working on right now.
Where did we end up, Sarah, on all of the medical closures that the state was talking about earlier in the year? I think they kind of got that squared away, but we didn't lose anything or the opportunity for our people to go to New Mexico or Colorado, right? They're not
forced to go one
They're not
direction or
forced to
another.
go one direction or the other. They
Right.
can go to, okay.
Right. See, in Montezuma County, we're stepchildren of New Mexico. They don't want us, and they won't incorporate us into Colorado. So we're in the unique position. People can choose to go to Grand Junction, or they can choose to go to Albuquerque system. If you go to the Albuquerque system, you use the Durango Clinic. If you go to Grand Junction, you use the Moab Clinic. So it just depends on your preferences as to what direction you want to go. You don't have to enroll in one or the other. That's a decision you make
So
solely
it's,
based on your
it's
medical
still wide
needs.
open for our veterans here. They can
Yep.
pick and choose whichever way they want to go. Okay.
Yes.
Good. And then on the eastern slope, did they ever close any of those, or did they leave those open?
As of this year, I believe everything is still open.
Okay. Good.
So they were working on a couple of clinics in New Mexico, which don't really affect our area here. We don't have any veterans that go down that far to those smaller clinics at this point. But overall, everything within our system and the stuff that our veterans use, everything is still open.
All right, thank you.
You're welcome. Was there anything else?
No, ma'am.
No, ma'am.
Are your-
Thank you.
Your decisions, are they turning around pretty fast for you on your cases?
Right now, it depends on how complicated it is. If we have, it's based on how many disabilities they claim. So if they have like less than 3 disabilities on there, so like hearing loss, tinnitus, and 1 physical injury, those are being settled within 3 to 4 months. If they have 8+ contentions or even 5+, just overall a lot of stuff on their claim, those are taking closer to a year, year and a half, because there's a lot of exams they have to attend, a lot of medical records to sift through. So it just kind of depends on what claim what you're filing for at this point. Most of the claims we saw for the month of October were simple claims. We filed them within the year of 2022, and they were settled pretty quickly, so.
Okay,
Okay,
thank you.
thank you.
All right, MoCo, Jennifer, transportation. Good morning.
So we're doing about the same amount of rides as we have been, between 700 and 900 a month. We are double booking right now because we were still short people. We have 4 drivers. And so Alex was going out to drive to kind of pick up some slack. We have 2 people that we did interview, and hopefully we can get through the background checks pretty quickly and get them trained and get them going, and that'll put me at 6 drivers, which is, I mean, it's not full, but it'll help a lot.
Yeah.
We have a lot of Medicaid rides now. We're picking up a lot of Medicaid rides, so so we need some people. But and then we had another one that has applied that has not moved here yet, so I may be full hopefully soon, but 2 more drivers is going to help a lot. We finally got some information on the new van that we're supposed to get. They're sending out the information now so we can start getting that going, so we can get one going. And hopefully have that by, I say, the beginning of the year, but it may be a little farther out than that. And we're good on, our vehicles right now.
Is that Ford also?
Yes.
Is it a Ford van also?
Yeah. Yeah, most of our vans are the Ford, like 450s and 550s, so, yeah. As far as that goes, that's pretty much all that's going on. We're doing pretty good. So-
Where do we stand on the fixed bus route?
I'm just putting the RFPs in, and as soon as I can get some bids on the studies, we can go forward. I've got, excuse me, I've got a couple that I know for sure that I can put out bids, that will put in bids, so.
And then how long will that take? Jennifer, once we actually get the,
The feasibility studies?
yeah, get it going.
You know, it really doesn't, it shouldn't take too long. And the reason I say that is because once you get the studies and you know you can do it, we don't have to buy, we can, obviously, we can get like another bus or two. But right away, we won't have to because we'll just be doing like a couple of routes and just see what, what the need is. So I'm hoping to be able to start it by the end of this year. I mean, next year. Because we are at the end of this year.
Yeah.
So I'm hoping by summer, actually.
Great.
Because summer, I think, would be the best time to start it.
7-8 months then.
Yeah, I think so. And then we have another one that we just got you'll be getting a DocuSign for that. It's the IT grant that we got for $24,000 to help us maybe get some stuff going for people on their phones, apps and things like that we can pay for, and they can just book online or book in their phone and that kind of thing. So that'll be nice. So,
Good.
yep. Any questions?
No, thank you.
Right, thank you.
Thanks, Jennifer. Okay, Jerry, come on down. We have a liquor license renewal for the Double R Liquors.
My name's Jerry Fazell. I'm from Montezuma County with liquor license renewals. Today I have one for Double R Liquors LLC located at 18794 Highway 491 in Lewis. And I've got the background check from the sheriff and no record of violations.
You guys okay?
You bet.
I move to approve this fermented malt beverage liquor license renewal application for Double R Liquors at Lewis, Colorado at 27720 Road. Oh, that's their home address, isn't it?
Yeah, business address is the 18794.
Oh, here it is, 18794 Highway 491, Lewis, Colorado.
Second.
Okay, it has been moved and seconded to accept the retail liquor fermented malt beverage 794 Highway 491, Lewis, Colorado. All those in favor?
Aye.
Aye.
Okay.
Thank you.
Do you have Mr. Dietrich here, or we still have this, that we didn't sign this IGA with CDOT? Or do we need to?
I've reviewed it.
There he is right there.
There he is. James, come on down.
Morning, gentlemen.
Morning.
Morning.
First thing I wanted to touch base with was the Paso Mesa Verde IGA, and well, it seems loud somehow there. But I did get a notice that that the electronic document had been signed, so I think we're okay on that. So we're still awaiting the notice to proceed on that before we can start billing against it. That should be forthcoming. We've met with the with CDOT to do the scoping meeting and everything on that IGA. Everything appears to be fitting in pretty well as far as that goes. So that will be continuing to move forward, and then we're still waiting the IGA for the Cortez side, which will continue the planning work on segment A. So the prior IGA, to clarify, is on the Manca side, and that would be for segment C and D. I guess that covers most of that. I did meet with the Central Federal Lands Highway Division last week. I mentioned that for the scoping phase for C and D. We've got a couple of issues there. One of them is the business connection, Highway 160. As we all know, that there's a pretty steep embankment on the south side there. Currently, we're analyzing different ways of dealing with that. Right now, the most likely scenario looks like actually just shifting the highway north just a few feet. The embankment on the north side of that highway is pretty shallow, and of course, way more shallow than on the south side. So just shifting it by, maybe 6 feet north or so, we can pick up enough room to fit that trail in at the top of that embankment, follow the highway grade right down to the pedestrian crossing. The other complication there is, of course, that inlet or that box culvert that takes Chicken Creek through. That thing has got some wing walls that are in pretty bad shape, so CDOT's evaluating whether or not we need to redo that box culvert at this time when we do the trail, that is. It's possible that we still may be able to add just an extension onto that, and the idea would have been to run that trail right across that. That would solve that crossing problem. So then we're left with some of the striping and things like that, still having some discussions on whether or not to offset the highway crossing there to get it to the north side, or whether to do a 90 on that. So all these things with CDOT unbelievably take an awful lot of time. We're also working forward with the Affordable Housing Strategic Plan. That project is underway. We had our first meeting with Ayers Consulting a couple weeks ago, and we'll be following it up with a meeting on December 7th. Currently, they're reviewing all of our local policies and codes, so hopefully we should have a productive discussion when we get to that on December 7th. We're also continuing to meet with the CFLRP coordinating committee, and also their Projects and Places committee. I think we've worked through most of the paperwork and reporting that we need to do for the federal compliance this year, and at this point we're really starting to work through desired conditions for projects for the following subsequent years. Once we get our desired conditions kind of ironed out, then we'll be able to pair up potential projects out there with what the desired conditions and also what the CFLRP legislative language asked us to do. And of course, I'm also continuing to meet with the Dwarf Collaborative. That's kind of ongoing. That will be ongoing probably for the foreseeable future. And then I've also got several hits on the OREC grant that we've submitted the RFP out for. I've got 4 firms that are looking at that currently. And that'll close November 30th. So presumably they're all putting together proposals, hopefully anyway. So, and that concludes my report for the day, gentlemen.
All right.
All right.
Thank you.
Thank you.
James.
Okay, gosh, we're no planning today. We're motoring right straight through this. Okay, Ian, we'll go right straight to you.
I don't have a lot to report this week. Spent some time working on the documents that'll accompany the licensure applications that we'll have for the licensure of secure vehicles. So spent some time on that, and we should be set to pass a resolution on that next week. We talked about that a little bit in our workshop. Other than that, I don't have anything to report.
Okay, thank you. All right, Travis.
Just a few things, address some concerns over the Sky Mesa Estates property tax issue that occurred, what was it, a few years ago. They're wanting to get that kicked off based upon Perrin County put in some roads, and so now they're having to repay the initial loan. Dealt with that. Attended a public purchase Zoom meeting, and that's basically for automated RFPs. So I'm going to try to get some of the department heads that actually put out a lot of RFPs involved in that. We got the architect drawings back for the restrooms at the fairgrounds. If you gentlemen would like a readable copy, I have a copy of that on my table. And then the Brownsfield and CDPHE attended a meeting with some stakeholders on that. Jessica elaborated. And so we're going to try to get some of that stuff kicked off and start addressing some commercial properties. And then had a meeting with Mountain West regarding our property loss and safety programs. We're getting them some documents so that hopefully in the near future we can reduce our liability premiums. So, and then we met with the Fair Board last night. Went really well. Updated them on some of the projects that's going on out at the fairgrounds and what we can do to help them be successful. The last thing I have, excuse me, is our register and our financials for October. For the general fund total, it was $1,174,120.63. Pull that up real quick. Road and bridge was $306,865.14. Public health was $174,369.26. Capital fund total was $22,122.72. Administration fund $17,568.20. Landfill total was $501,305.02. Check register total was $2,196,350.97. And social services was $1,813,888.69. Grand total was $4,010,239.66.
Question on that, gentlemen?
No. I would so move, we approve the financials for October of 2022 in the amount of $4,010,239.66.
Second.
It's been moved and seconded to accept the payables for October 2022 in the amount of $4 million. The big number gets bigger all the time. $10,239.66. Any further discussion? All those in favor?
Aye.
Aye.
Aye. Okay. Is that it, Travis?
Yes, sir.
Okay,
Yeah.
Commissioner Lindsay.
We attended the workshop yesterday, pretty short meeting. Did some business with the E911 board also yesterday. And had some phone calls, a couple of really interesting phone calls that we're going to look into. And other than that, city council tonight. That's all I
Very
have.
good. Commissioner Copenhaver.
I don't have much to report this week. We did finish up the outlet structure at Groundhog. Actually, it's been finished for about 10 days or 2 weeks now, and we do have the gates closed and it is refilling, so that project is all finished for the MVI there, and when Minucci finished that project up. So we should be in pretty good shape there to start storing some water back in that reservoir. Just to let everybody know around the community that that project's done.
Very good. Okay, I had a couple meetings, obviously one with our attorney, Mr. McLaren, and talking to some other attorneys throughout the state, dealing with some issues that we have going on in the county. Actually took a day Wednesday and went actually to the mountains and went hunting. It was a nice day off. Got to see a lot of elk, but was unsuccessful. Came back in, like the other two commissioners stated, we did have a workshop yesterday discussing our secure transportation and county licensing requirements as it pertains to House Bill 21-1085 that we have to get implemented and started by the 1st of 2023. Our E911 board meeting, shortly after that, the discussion of the logger contract. And there was a special funding request for SHS for the EMS portion of that for the CAD system as it relates to dispatch. Again, with Mr. Anderson last night, attended the Fair Board meeting, kind of went over their budget and upgrades that we're planning on doing out at the fairgrounds that we have talked about and discussed. And the biggest one there is to order the transformer for the lower barn system so that we can get the circuitry fixed for the RV spots on the south side of that. And again, like he stated, drawings for the bathrooms on that lower section so that we can get those upgraded and taken care of. And with that, I have nothing else, gentlemen.
Motion to adjourn.
All right.
Second.
It's been moved and seconded to adjourn this November 22nd meeting of 2022. All those in favor?
Aye.
Aye.